everyone, and welcome to this next episode of #CArthritis, one of a part of a series of interviews with fantastic guests. I'm Cheryl Koehn. I'm with Arthritis Consumer Experts, and we host through the Arthritis Broadcast Network the #CArthritis event. I'm so excited. I get to talk to Dr. Lori Tucker and Ms. Brittany Barnes today about kids and arthritis. And it's probably right away, we've already surprised people who are watching. What? Kids get arthritis? But specifically, we're going to talk about the work that you're doing at this year's annual scientific meeting. But before we do that, welcome. Great to have you here.
So nice to be here. Thanks so much for inviting us.
Yeah,
Thanks for having us, Cheryl.
you bet. And let me tell the audience a little bit about the two of you. I'll start with Brittany. Brittany joined Cassie and Friends, which is an organization that lives, eats, and breathes to serve kids with arthritis across the country. How's that for a little quick elevator pitch? And Brittany is the director of programs and partnerships, and she joined Cassie and Friends in 2019. She's constantly inspired by the strength and resiliency of kids and families affected by pediatric rheumatic disease, and uses her background in program development to help bring them new avenues of support. And of course, in her spare time, she enjoys hiking with her family and dog Obi. We'll have to talk dogs after this, Brittany. Dog. She loves talking politics, no shortage of that these days, and sharing laughs with friends at a local brewery or park or wherever you happen to find yourself. So welcome, Brittany.
Thank you.
Dr. Lori Tucker is a longtime friend, collaborator, inspiration to myself and to our organization. She's a clinical professor in pediatrics at the University of British Columbia and the division head in the Department of Pediatrics at BC Children's Hospital, which is one of the leading care centers for kids with arthritis in the country. Her clinical research focus areas include prediction of outcomes for children with juvenile idiopathic arthritis and improving care through longitudinal outcomes registries. So collecting information over a long time, to put it short. She also studies the physical activity in children with juvenile idiopathic arthritis, transition of youth with rheumatic disease into adult care, which isn't always easy or seamless, as we've learned, and translational research in autoinflammatory diseases. So all of those big, heavy words mean that she is a crackerjack expert in her field, and we're so lucky to have her. And she also serves as the medical advisor to Cassie and Friends. So a dual connection here in terms of our discussion today. So welcome again. We're going to dive right in, you two. First of all, in your own words, tell us a little bit about what you do in your day.
I will start because maybe this is sort of more simple. And I'm a clinical doctor, so I work in the various pediatric rheumatology clinics that we have here on site at Children's Hospital. And I also do outreach clinics and have done that for years to the north of BC. I generally go to Prince George a couple of times a year, and we have clinics up in Terrace. I lead a group of pediatric rheumatologists, nurses, a physiotherapist, an occupational therapist, and really our primary goal is to deliver the best quality patient and family-centered care that we can to kids with arthritis and other rheumatic diseases in BC. Every day is super different. I do research, I see patients, I work with Cassie and Friends, so every day is pretty different.
Very cool. You to me, you're just the it person in pediatric rheumatology. I've known you for so many years, Dr. Tucker. Tell us, how many kids across the country have some form of arthritis?
Well, it's kind of a funny thing because, believe it or not, the statistics are not great. But we could say that 3 out of 1,000 kids, have juvenile arthritis or some other rheumatic disease. So I like to tell people that if your kid goes to the average size high school, there's at least 3 or 4 children in that school, young people that have arthritis or a rheumatic disease. And I think that makes it simpler for people to understand.
Yeah. Yeah, I mean, it's just shocking to think you walk into an elementary school and there's arthritis there. Like the public
Yes,
still doesn't
every
quite get
single
it.
school will
Yeah,
have a child with arthritis.
yeah,
And they're not, it's as many families will say, it's a fairly invisible disease. They're not
yeah,
that obvious.
yeah. And true in adults as well. So
Yeah.
one of the comparators that's kind of dead on there. Brittany, over to you. What do you do in your day?
I agree with Lori. Every day is different, which keeps things really interesting and fresh. But at the same time, we look for those anchors as we go about our daily work. So every single day, we're connecting with families right across the country to learn about what their experiences are navigating juvenile arthritis and childhood rheumatic diseases. We're looking at the research. We're connecting with healthcare teams right across the country and having those conversations about how we can be that in-between support to change the realities for kids and families. So whether that's through our programming, such as our youth mentorship programming or our injection support kits, or whether that's getting right involved with research, whether that's hosting our family day events or our Team Cassie and Friends runs, which are now right across the country at all as well. Every single day is different, but anchored in our mission to really transform the lives of our kids and families.
Yeah, it's interesting. You both say every day is so different, and it's true about arthritis or autoimmune forms of arthritis as well. I
Mhm.
live with RA, and every day is a bit of a surprise with my disease. So that's very, very interesting. Tell us about what you're going to be doing at the annual scientific meeting. I know that's primarily why we're here to talk today, to sit together in studio. You're presenting both a poster and you're holding a workshop, and it's focused on leaving no family behind, a collaborative approach to improving care for families in northern BC. And I think generally speaking, our audience, probably most people in the country, understand that there are challenges in delivering care and providing support in rural, remote areas. So tell us about first the poster and what some of the key takeaways are of the poster.
Well, I think that it's important to look at the poster and the workshop as a kind of combined body of work.
Okay.
And I think that it may be of interest to people listening to see how that came about, because it really came about through a collaborative conversation between our team, where we have been going to northern BC for many, many years, over 20 years, to see children with rheumatic diseases who live even further away, 10 hours from there, and recognizing that we just maybe were not addressing the needs that these families had, but we didn't quite know how to even get there. And having a conversation with Cassie and friends who said, well, let's think about asking families and kids what their needs are. And so that really started this work, was that collaborative conversation. And what came out from there is a series of work that Brittany first participated in, where Brittany actually came to our clinics in northern BC and sat and talked to families and kids and got an idea of where the problems were for them. And honestly, like as a clinician, I've been doing this a long time. I learned so much even from that beginning part of the project. And then I guess I will let Brittany talk more about sort of what happened from there. How did we get to the poster and the information we learned?
Absolutely. And so just kind of jumping off what Lori said, we would not have been able to do this without such a strong relationship with clinic teams. And so I just want to highlight that as such an important approach that Cassie and Friends takes in its work, is that we have to start with building relationships with families and with healthcare teams so that we can have a holistic and collaborative conversation like we did in Northern BC. And then, of course, we looked at community partnerships to help make that work possible. Yes, we started with having conversations we connected with over 60 families at the end of all of this in Northern BC to really learn about, okay, from the point of suspecting that something's going on with your child to the point of accessing specialized pediatric rheumatology care. What did that look like? What were some of the roadblocks or barriers along the way? What were some of the things that you expected would be harder than they were? What are some of the solutions that could be in place to help? And how could whether it's Cassie and friends or the healthcare team or maybe government step in to affect some of these changes? So not to give too much away from our presentation, but what we learned was first and foremost, there was very low awareness within the general practitioner population when it came to childhood rheumatic diseases. So a solution there is obviously working to raise awareness amongst that group of healthcare professionals. And to expedite getting pediatric rheumatology care and treatment quicker, which ultimately means better disease outcomes. Another aspect, as Lori alluded to, was the long travel time. So we know that 50% from the research we ended up doing, 50% of the families accessing the clinic are traveling more than 200 kilometers each way to access care. And these aren't just your typical, Metro Vancouver roads. These are vulnerable or volatile, like unsafe roads that are often left to, the weather conditions, or whether that be the floods that we saw a few years ago, or forest fires, or icy roads that can then really impact their ability to get to and from clinic. It impacts their financial situation when it comes to if they have to fly, if they can drive, or if they have to overnight, if they have to bring their whole family because maybe they can't afford childcare. So situations that can be common to a certain extent in Metro Vancouver, but are certainly exacerbated because they live in a remote or rural community. So we collected all of this information. We hosted a really incredible family meetup event in Prince George. We had over 40 families attend, where we all came together to discuss. Lori actually presented on like the state of pediatric rheumatology, why it's important for us to come together, share our experiences. We had kids go off and connect with each other. For many of them, it was the first time they were meeting another person with the same disease type as them. So a really incredible event that created this momentum to move this work forward and to ensure it wasn't just a flash in the pan. The next step was we partnered up with a graduate student at Royal Roads University who wanted to do some legitimate research to gather data around these barriers and experiences for our families. So out of that work came some findings and recommendations. That's what is informing our research poster at the CRA, and then our project as a whole, and kind of how we can use this information to move forward and influence similar projects or inform similar projects right across the country is what our workshop will talk about.
Amazing. Caring, conversation, you put them together and it equates to change. And, you can have that one. I won't coin it. I won't patent it.
Let me write it down.
Yeah, exactly. But when I'm listening to both of you talk, those are the key ingredients. It's caring and communicating. And the communication isn't just between the two of you. It involved the kids, the families, the other community partners, as you pointed out. Just incredible work. So congratulations on that road that you've traveled, which sounds a bit scary for a lot of people, I'm sure. Where things usually break down is at the policymaking sort of stage. So I don't know if that's something you're going to talk about at your workshop, but tell us just very quickly about the workshop. This year's meeting theme is Ascending to New Heights, Peaks of Innovation in Rheumatology. So tell us, with that as the sort of through that lens, tell us about what you hope to accomplish at the workshop and how you're working to push pediatric rheumatology to new heights in the north in British Columbia. And I'm assuming you're going to want to duplicate this in other provinces if the model works. There you go.
Yes. And so I think the workshop, like I see it as a great opportunity for us to describe a little bit about what we've done in BC. But actually, I am really hoping that other pediatric rheumatology teams, allied health and physicians come to the workshop because I just have a lot of curiosity. So I think with respect to innovation and change, like I want to know, I think there are other people doing very good things.
Sure.
But we're not talking to each other and we're not sharing our experiences or our challenges. And so with respect to sort of policy and changing policy, I think we just have to start with understanding the lay of the land. Like who we want to know who's doing outreach clinics, in Nunavut, or if they are,
Right.
or, Northern Ontario or wherever, and what do they see as challenges? Because I think some of these things that we're doing are quite universal and the recommendations could be replicated in other places. But I think I'm just curious. And I'm hoping that other people, I think Brittany and I have talked about developing a community of practice. So, we have our own community of practice in provinces, but maybe what we need is to develop a community of practice across the country that relate to families that live in rural environments that have kids with arthritis and rheumatic diseases. So that's my hope.
Absolutely.
Well, it's a lofty one, and I'm sure that you're going to get there because not much stops you two powerful women. So, any additional thoughts to that, Brittany?
Yeah, actually, just jumping off of Lori's point about, we could replicate some of these recommendations, absolutely. Like, kind of a starting point for all of this work was to look at what existing research tells us about challenges for remote and rural communities. And we know that there are similar challenges across the country, but we also know that Canada is very diverse and different in its needs on a regional basis. So to Lori's point, really honing in on what are other clinics doing and how could they adapt some of our approaches or some of our recommendations that we've laid out here, and then what are some of the higher level solutions that we might be able to come together to implement right across the country, kind of as Lori's talking about a community of practice. And then to your point about the government policy aspect, absolutely, that is a huge undertaking. And there's a lot of work pre-work to be done before, we're ready to move forward with that kind of campaign or coalition or whatever that might look like. But in the interim, what are some of this short-term solutions that we can implement? So for example, in Northern BC, immediately when we heard that there were some financial challenges that families were facing or barriers, working with our community partners to fund gas cards or grocery cards that we could supply to families, or ensuring that numbing cream, which we all know is a high cost out-of-pocket expense, was readily available to them. So in the workshop, we'll definitely identify some of those short-term solutions that clinics can adapt, but also dive into, okay, what are your remote and rural communities and what might be different from a regional perspective than, say, Northern BC?
Yeah, and I gather, that we have in our northern and rural remote communities large Indigenous populations, and there are very specific needs for their communities as well, and so much partnership building and reconciliations obviously need to be taking place concurrent to that. So I know how challenging work like this can be. And it's just amazing. I think one of the most important things that Cassie and Friends does and has done so well since the day it founded is listen to families and kids. You have conducted such fantastic listening exercises, and you can't create a solution unless you listen and you think about what people are saying and then figure out what tools you currently have that can be, sort of ported over, if you will, to help them. So huge congratulations to you, Brittany. I know that under your leadership, this work's going to continue and will be terrific. And Lori, Dr. Tucker, you've been this foundational sort of this post in a building, and all the other posts sort of to me are built around you. So congratulations to you. So let's wind up here a little bit and let you get on about your day of looking after kids with arthritis. Tell us sort of about future forward. Like, what are you working on? Besides the things that you've just talked about, which I know are not completed, I know those are in the gestation period, but what else is on the sort of near or far horizon for Cassie and Friends and Dr. Tucker for you in your research?
Absolutely. This year, you're going to see a big focus on kind of very, very relevant actually to our work in Northern BC, but raising awareness and ensuring we're creating those connections. So we know that without awareness, I just kind of mentioned the situation with the general practitioner community. Without that awareness, we really can't access things like the precision medicine that our families need or the research to further treatments or ultimately find a cure. We're not going to access the funding or resources that we need at a government level, or even, just the day-to-day awareness that families need to feel understood and validated and really address those feelings of isolation that can come both with where they live, but also in just navigating every day with comments of, oh, your child's too young to have arthritis, which we mentioned at the beginning. So you're going to see a strong focus on that. You're going to see a strong focus on building up our family navigator program so that our parents have someone that they can talk to when they're diagnosed and point them in the right direction of evidence-based information, which we have a huge hub for on our classroom resource hub on our website, which our partners like Lori have helped us to build over the years. And then, of course, our family days are back finally. Our last family day was in BC in 2019. And then, of course, COVID put that on a hold for us. So we're going to see Family Day back in BC at the end of this year in November, which has over 400 families that typically come out, as well as healthcare industry partners, and just all come together for a day of learning and connection. So
love that day. I've had the absolute honor to be participant in it a few times. So congratulations on that. And it sounds really super exciting. Dr. Tucker, when are we getting a cure?
Well, I think that there's a lot of really impressive and amazing Canadian-based research going on now. And I will call out, my colleagues at Sick Kids in Toronto who are leading some really large, innovative projects looking at, how we start medicines, when can we stop medicines, and collecting information and samples that I think are headed towards that direction.
Yeah.
The other thing that I think has been really, this sounds so boring, right? the whole idea of like, oh, let's collect information on people. And
It's a
but
stepwise
I,
process, hey?
yeah, I want to
Yeah.
say that there's been some really great work on the part, I think, of the Canadian Organization for Rare Diseases and other rare disease groups like ACE, actually, to get the Canadian Drug Agency to put money into rare diseases in childhood. And
Mhm.
the really great thing is that some of that money, it's aimed at trying to set up ways of doing clinical trials with new drugs for kids with rare diseases, which is a challenge. And some of that funding has come to pediatric rheumatology, which is fantastic. So that's something that people in my group are working on, both like developing really good ways that we can have large databases where that are ready to like identify kids who might be eligible to be in new clinical trials. So I think that's really a great step forward. And I think that is an innovation and something that will lead to better treatments for kids with arthritis and rheumatic diseases in the future.
Yeah, that's super exciting. I know I was reading some grant award results, and I think pediatric rheumatology had taken what, three or four of the major grants that were given out. So, which tells you that the reviewers think you're doing fantastic, much needed work. So,
Yeah,
huge congratulations, Dr. Tucker. I know you're leading at least one of those teams and participating likely in a couple of others. So congratulations on that. I don't want to take up more of your time. It's been an absolute pleasure sitting with you today. We wish you the very best of luck in your poster presentation. I know you won't need it, but just a little bit extra never helps. And I hope the workshop is super, super productive and you get out of it what you want and need in order to care for the kids that you support every day in your working lives. So thank you so much for being with us. And to our audience, thank you for tuning in. We hope you learned a lot about Cassie and Friends. By the way, it's www.Cassie and Friends, all spelled out, CASSIE and Friends.ca.
That's right. Thank you.
So please go to their website. They're a charitable organization, so your support makes a difference in kids' lives with arthritis. So until next time, thank you for joining us in the hashtag #CArthritis interview room. Bye for now.